Okay, corneal lacerations. Partial thickness lacerations. The sign is the anterior chamber is not entered, and therefore the cornea is not perforated. Workup. Careful slit lamp examination should be performed to exclude ocular penetration. Carefully evaluate the conjunctiva, sclera, and cornea, checking for extension beyond the limbus in cases involving the corneal periphery. Evaluate the depth of the anterior chamber and compare with the fellow eye. A shallow anterior chamber indicates an actively leaking wound or a self-sealed leak. A deeper anterior chamber in the involved eye can be an indication of a posterior rupture. Check the iris for TID and evaluate the lens for a cataract or a foreign body tract. Must have a high level of suspicion with projectile objects. The presence of TID and lens abnormalities indicate a ruptured globe. IOP should be measured only after a ruptured globe is ruled out. Use applanation only if the laceration site can be avoided. Otherwise, use a tonal pen to check the IOP. 2. Seidel test. If Seidel test is positive, a full thickness laceration is present. A negative Seidel test indicates either a partial thickness laceration or a self-sealed full thickness laceration. Treatment. A slight cycloplegic and antibiotic, for example, frequent polymyxin or bexitrasen ointment or fluoroquinolone drop, depending on the nature of the wound. 2. When a moderate to deep corneal lacerations is accompanied by a wound gap, it is often best to suture the wound close in the operating room to avoid excessive scarring and corneal irregularity, especially in the visual axis. 3. If corneal foreign bodies are present and superficial, treat per sections 3.1 cornea and conjunctiva foreign bodies. If foreign bodies are in deeper cornea, there are no signs of infection or inflammation and are well tolerated, they may be left and watched closely. If the patient is symptomatic or signs of infections or inflammation occur, deeper corneal foreign bodies should be removed in the operating room. Follow up. Evaluate daily until the epithelium heals. Full thickness corneal laceration. Note that small self-sealing or showing leaking laceration may be treated with aqueous suppressant, bandage, soft contact lenses, fluoroquinolone, QID, and precaution are listed.